This is one. Are you always getting caught out by subscriptions? You sign up and forget about it until you build next year unexpectedly.
Well, the Labour Party says that should be banned so that we don't get stung. Well, joining us now is Shadow Business Secretary Jonathan Reynolds. Good morning to you, Mr. Reynolds. Really good to have you with us this morning. So tell us, Labour want to change the law to stop us all being ripped off by these subscription traps. Tell us more.
We do, yes. So subscription models are big business, and it's a growing business in the UK. It's worth over £25 billion. So this is a very significant market. But what we are taking action on today, what we're putting forward, is a plan to stop what are called subscription traps. So that's where you take out a free trial, maybe a subsidised trial. I could probably give you some personal examples of things that have caught me out. And then it automatically renews. You weren't really intending for that to happen. And you're tied into that longer term relationship. And all we are saying is we're going to change the law under a Labour government, so you've got the choice. There might be some things you want to auto-renew, and insurance is a good example of that, where you don't want to be without cover. Everything else, you should be given the choice. If you want to auto-renew, great, but if you don't, that is available to you when you sign up. And I think that is an important change for a growing market, or something that will be more significant in future. But in a cost of living crisis, where every penny counts, £300 million, Citizens Advice say every year is lost to things that people didn't really want. It's a change for the better, and I'm really pleased we can put it forward today.
Yeah, look, I think most people would go, yeah, absolute common sense. You won't be remotely surprised then if 6 months' time the Conservative government brings this in, will you? Because it wouldn't surprise me.
Look, I never mind when they steal our policies. If you're winning the battle of ideas, that sometimes happens, and we've seen a little bit in the last budget, haven't we, on things like childcare, where they did that. I mean, we have a view of this country that it could be much better, it could be doing much better than it has been for the last 13 years, and we're going to put forward those ideas because we want people to do that. If the government borrows some of these, if they steal them, well, fair enough, but that's how you make the running as an opposition. And I do think a change like this, look, I think many of the things that I come on to talk to you about quite regularly, about industrial strategy or clean energy, or how we can make Brexit work better, would be a much better environment for UK-based businesses. But alongside that, I do want people paid well, I want them to have good employment rights, and I want them to have strong consumer protections, and that is the pitch we're putting forward. I don't think the government can replicate all of that, but when they steal our ideas, I never mind that.
Mr. Reynolds, whilst we've got you, I wanted to ask you about the nurses that the RCN have rejected the government's offer of a pay rise of 5% and a one-off payment as well. Do you think they were right to reject the government's offer? And what would Labour do in order to strike a deal with the RCN?
Look, so it's a difficult situation, clearly, where you've had one union accept, Unison's members accepted the offer, the RCN hasn't, and we still haven't had the results yet from GMB and Unite, so we're going to need to see that full picture. I'd say what we can tell from what we've seen yesterday is, first of all, a resolution is relatively close. I think the government should have negotiated sooner. This shows this was always resolvable. But specifically what we would do differently, I think this probably would go quite a long way to resolving the dispute. This has always been, yes, about pay, but it's also been about the burden, the workload NHS staff are under. And if you take our plan, which is to abolish the non-dom super tax regime for very wealthy people, use that revenue, over £3 billion, to expand the NHS workforce, you're giving people some hope that some of the pressures they're under in future are going to be resolved. And I think that's all they've ever asked from the government is, yes, action on pay, but a recognition that the pressures they're under are very significant. And I think our plan, taken as a whole, would go a long way to resolving this dispute.
It all gets very confusing, though, doesn't it? Because, I mean, the non-dom money tree and the windfall tax money tree seem to be the answer to everything at the moment. It's not a case. It's not a case, is it, with the NHS, which I think I struggle to find anyone who didn't think it was on its knees at the moment. It's not just a case of ploughing more money in, is it? I mean, there's got to be, and to be fair, Wes Streeting seems to push on this quite a lot, so some pretty root and branch reform.
Well, absolutely. Keir has and Wes has put forward plans that are about reform as well as investment. I mean, we've talked, for instance, about how people could access secondary services, not necessarily going through GPs, to alleviate some of the burden around those. But I do think if you look at the waiting lists, that, to be honest, the state of the NHS before the pandemic hit and what was happening there are these real issues around capacity. I think if you can expand the workforce and address those, that's not just a good healthcare policy, it's actually very good economic policy because there are a lot of people in this country out of the workforce because they're waiting for NHS treatment. I think that makes a lot of sense. So the Labour position is for more investment, but we'd say where that money would come from. I think that's fair and reasonable to do that. And it is for making the NHS work better for patients. It's money and reform, investment and reform to deliver the kind of health service people need. Very similar to what Labour did in government last time. Of course, we left power with the NHS getting record satisfaction from the British public, and that has changed very much over the last 13 years. So again, it's ideas from Labour, it's ways, positive changes, the difference that can be made, and I think that is the right way forward for an opposition to say how things could be better, because I would agree with you that the state of the NHS today should be to no one's satisfaction. It's not the fault of the people who work in it, who are incredibly committed and have been under incredible pressure. But it hasn't been handled well by the government, not just for the post-pandemic period, but actually for the last 13 years. So money, reform, investment, that is what's required to get us the NHS we need. But when you talk about fundamental reform, I would just say, let's never lose the brilliance of the NHS model, which is when people need care, they've already paid for it through the tax system, and it's free at the point of delivery, delivered by a publicly funded, nationally accountable National Health Service. I think that's what the British public still want.
Just briefly, you say the incredible people who work in the NHS. You could have a situation now, I know it's slightly hypothetical, but you could have nurses who are with Unison saying, actually, nurses with the RCN are being greedy now. They've accepted the offer, the RCN haven't. Are they being greedy?
No, I don't think anyone is being greedy. I mean, if you look at where inflation is at, double-digit inflation still, if you've got alongside that food inflation way higher than the headline rate of inflation, none of these workers at the minute are talking about pay rises that go beyond that. This is not the 1970s, but this is people asking the government to listen to the pressure they're under, the cost of living pressure and the workforce, the burden on them in terms of when they are at work. And to be honest, before they got round the negotiating table, the government just refusing to listen to that case. And I don't think anyone can say that the kind of pay settlements being discussed actually in a whole range of sectors is somehow a bonanza for public sector workers. No, they're just asking for some recognition that the pressure they're under is extreme. Energy prices and food prices, transport prices, these are real burdens on them. And I don't want to see the government demonise workers who are just asking for the right to be heard and for the right for the government to understand some of the pressures that they're under.
Jonathan Reynolds, good to talk to you. Thank you.